Hi, my name is Karen Liberia. I'm a pelvic floor physical therapist at Northwest Ohio Center for Pelvic Rehab, and I wanted to put together this video for men with pelvic floor dysfunction to know what to expect with your very first pelvic floor PT evaluation. So most every PT place that you're going to go to, you're going to fill out some paperwork just talking about your history in terms of bladder, bowel, sexual dysfunction. So that could look anything from urinary urgency frequency, post-void dribble, meaning if you're dribbling like once you think that you're done going to the bathroom, constipation, if you have trouble with erectile dysfunction, either meaning having difficulty getting an erection or maintaining an erection, because that tells us different things, or if you're having pain with sex or pain after sex or pain with ejaculation, like all of those questions that we go through give us an indicator as to what we think might be contributing to your symptoms, and we can evaluate you with that intention in mind of understanding what's going on with your body and why. So after you fill out the paperwork, we sit down and have a conversation. So usually most of our evaluations are anywhere from 60 to 90 minutes, so we can really get your full history to understand what got you into these symptoms in the first place. So in terms of the history taking, we also do a lot of education so you have a better understanding of what's happening in your body and why. So for example, there are these diagrams that we might get out so that you can show us, for example, if you're having pelvic pain, where exactly you're having the pelvic pain, as that will indicate to us what might be the driver for the pain that you're experiencing. Is it coming from your pelvic floor or is it coming from your spine? The other aspect that we'll instruct you about or educate you about is your pelvic floor. So here is just an example of a male pelvic floor where your tailbone is down in through this area, your pubic bone is in through this area, and here is the rectal canal here. So these are all the muscles of your pelvic floor. So if you are having more difficulty with, say, pelvic floor muscle endurance that's affecting your ability to maintain an erection, we can assess these muscles by either doing a rectal assessment to make sure that you're doing the Kegel correctly, and then something that's called biofeedback, where we can put these little sticky pads on either side of the rectal opening and have you hooked up to a computer for us to be able to visualize the activity of your muscles. So once we know what your muscles are capable of doing, then we can start creating an exercise program for you. So the evaluation will entail taking a look at your spine and your hips, likely doing biofeedback with you if that is appropriate, and then possibly doing an intrarectal assessment where we're doing a rectal exam to determine if there's any tension or weakness that might be contributing to your symptoms. And then once we have all that information put together, we come up with a game plan for a treatment plan for you. So I hope that answers any questions that any of you might have for what to expect from your very first pelvic floor PT evaluation for any male patients that are coming in. Okay?